We're joined live now by Dr. Dominik Nowak, president of the Ontario Medical Association. We appreciate your time, doctor. I want to get your reaction to today's announcement. And do you think this is enough investment? Do we need more?
Look, we know that primary care is in crisis. It's a crisis that nearly 1 in 4 people across this province can't find a family doctor. And this is an important step in the right direction, an ambitious plan by this government and by Dr. Jane Philpott, a trusted physician, to get our healthcare system back on track, starting with connecting everyone with a family doctor.
I'm curious, doctor, how do we attract doctors from outside of Canada to want to come to Canada? How challenging is that right now?
Yeah, look, and we have a situation where we are trying to attract doctors into family medicine, including medical students and residents, into practicing comprehensive family medicine. And that's going to take a few things. Number one, let's make it more financially sustainable to be a family doctor in this province and to start a family practice. And then two, let's make sure that our family doctors, are able to focus on being doctors. Right now, they're spending 19 hours a week on unnecessary red tape and bureaucracy in our healthcare system, and that's taking us away from caring for patients. So those are the things that we can do to bring in medical students, residents, and international graduates into practicing primary care family medicine for everyone in Ontario.
I'm curious, do you think that the recent reduction of immigration numbers by the federal government is going to impact the number of international students who want to come here to one of our medical schools and then maybe end up living here? Do you think that's going to impact the situation?
You know, what I'm seeing is a shortage of family doctors practicing family medicine. All options have to be on the table. We have seen new pathways for international graduates to start a practice in Ontario, and that's an important step in the right direction from this government. And we also need to make sure that we're retaining the family doctors that we do have already here in the province, and by the way, already ready to practice family medicine in Ontario, including many that I've met over the last few weeks, months, and years who are family doctors that are trained in the system, don't necessarily feel the support, including financial, to do family medicine or in other parts of the healthcare system, but we can pull back into doing primary care as a result of an announcement like this and others, I hope, in the months to come.
I would assume that there's also concerns about, many of the baby boomer generation doctors who are now in the process of retiring, and that's happening as we speak. I'm wondering what your concerns about the exodus of people retiring and the gap that's going to leave. I know that the government is trying to make efforts to try and bridge that gap, but this is, I would imagine, another area of concern.
Yeah, and we've seen a situation in our healthcare system where people are losing their family doctors, people are losing access. It's gotten more and more challenging in the last few years and months. And by the way, that number of doctors that are thinking of scaling back or retiring in the next 5 or so years is around 40%. So that's why it's important that we think about recruitment, bringing in new doctors on board into family practice, but also retention. So how do we work on keeping the doctors that we do have already in our system in practicing primary care and family medicine, and with our goal of attaching everybody in this province to a family doctor?
Doctor, we got about 30 seconds left, but I want to circle back to what you just talked about, recruitment, and how do we potentially incentivize people from outside of Canada to want to come here? And when they look at Ontario, this is, the cost of living is extremely high. The weather's not very good for over 6 months of the year. Not to mention, we've got housing costs are out of control for a lot of people. There's a lot of things that might direct someone's attention to maybe another country and take their expertise there. How can we incentivize and encourage other doctors to say, we want you to come here to Ontario, and this is how we're going to incentivize that?
It has to be around supports, but also funding. The reality is that the business model for family medicine, many new graduates, many people who are thinking of setting up shop in Ontario see as no longer sustainable. So that's why we need to be focusing on building out teams, building out the supports for family doctors to do family medicine, but also funding family medicine and funding family doctors to do the important work that they do.
Dr. Dominik Nowak, president of the OMA, the Ontario Medical Association. Appreciate your time. Thanks for joining us.